Hey, it's Julie over here at ICOHS. I am one of the instructors at ICOHS. Thanks for joining us on ICOHS TV. I am here with one of our students, Sadie, and today we are going to talk about the scapula and why it is so important for people who have neck and shoulder pain. So the scapula, people don't even know where it is. The scapula is actually on the back side of the body. It is the shoulder blade, it is the wing, it is the scapula. That is what it's known as. It is comprised of a shoulder girdle. It helps to stabilize the entire shoulder, comprised of the clavicle, the humerus, which is your arm, and then this big bone in the back. This is where your scapula is. She has hers tattooed so you can actually see where it is. So lucky us. So it is the most underrated area in the body. And the reason I say that is because this is what helps keep us upright. It also helps keep us pain-free in the neck and in the shoulders. However, the scapula unfortunately doesn't get a lot of work, even though there are 17 muscles that attach to it. We have muscles that attach to the top and the inside, on the bottom, on the other side coming to the front. This scapula has a lot of movement that's associated with it. And unfortunately, we tend to focus more on the front because that's where our eyeballs are, than onto the back. So the main movements of the scapula, it is supposed to elevate, it is supposed to depress, it is supposed to protract, it is supposed to retract, it is supposed to upward rotate, and it is supposed to downward rotate. And the majority of people actually leave it in a protracted position because they have rounded shoulders. And when they have rounded shoulders, they tend to overuse the upper fibers of it. Okay? Relax. So now we're going to get into the muscles. There are 3 different sections of muscle fibers of the scapula. So the trapezius that attaches to the scapula, we have the upper trapezius that comes out of here, and then it comes right down here. And it actually helps move the scapula around. If the scapula isn't moving, then the upper fibers of the trapezius get overly tight. So they become tight and short and weak. And then they end up giving us a headache, they give us neck pain, they give us shoulder pain. And unfortunately, the middle trapezius and the lower trapezius fibers of the trapezius, obviously, are supposed to stabilize the scapula and depress the scapula, and they don't do their job. And so this gets overused. So the reason why we focus so much on the scapula is because it actually will take away all of the head and neck pain that we are getting from being in a forward shoulder position so much. So Miss Sadie, I want you to pull your shoulders straight down for me. Depress. Good. Now if you notice, when she pushes her shoulders up into the air, go ahead and push them to the ceiling. Do you see how nice and tight they get? If her scapula wasn't moving, these wouldn't move anywhere. So they would just be sitting like this all the time. So now I want you to push your shoulders down into your rear end. Perfect. And you see when she drops her shoulders, all of this relaxes. And when she pulls her shoulder blade down, or her scapula down, it is part of upward rotation. So she's going to downwardly contract her scapula, and that's going to allow her to raise her arm. And then watch her raise her arm again. And then watch her raise her arm again. And then watch her raise her arm again. Yes! If you have any more questions, please join us. Don't forget to subscribe, leave your comments below, and we will see you the next time on IGTV.